Recognize the member for Fredericton South and leader of his party.
Thank you, Mr. Speaker. Politics are so interesting, aren't they? My goodness. Up to this point in New Brunswick, the Conservatives and Liberals had a consensus on access to abortion, which was to limit it. But the Liberals evolved. Liberals evolved. Only recently, mind you. But what we're not seeing is the progressive Conservatives progress, and it's in their name. It's interesting, Mr. Speaker, this Regulation 8420 goes back to Frank McKenna, way back to Frank McKenna. So it was a Liberal regulation, let's say, really, back then, when this was following the 1998 Supreme Court decision, and Frank McKenna promised to give Dr. Henry Morgenthaler the fight of his life and proclaimed that he would never be able to open a clinic in New Brunswick. Well, Dr. Morgenthaler did open a clinic in New Brunswick, so McKenna established the provisions in Regulation 8420 to restrict Medicare coverage of abortion services to those performed in hospitals and imposed the two-doctor rule. Exactly some of the things that the Supreme Court had found unconstitutional. But as I said, the Liberals have evolved, and that's a good thing. So I'm very, very pleased that the member from Caraquet presented this motion, supported by the member from Rescouche-Chaleur. When I heard the amendment from the Minister of Health, the first word that came into my mind was unreal. I don't know why, but unreal. Unreal. To quote one of the members to my right here. Incroyable en français. Également, incroyable. Et dans les deux langues, il est ridicule. You look at the resolutions in the motion, Mr. Speaker. It's not all about Clinic 554, as was just suggested. It's about urging the provincial government to repeal the section of 8420 of the Medical Services Payment Act that prevents payment of abortions outside of a hospital setting. Point. Period. Everywhere. And, of course, that the Legislative Assembly urged the province to fund services provided by Clinic 554, recognizing the unique mix of services provided at Clinic 554 that serves so many in our diverse community, here in Fredericton, in my riding, in the entire city, and in a large swath of New Brunswick, Mr. Speaker. So, one of the things that we know, Mr. Speaker, is that providing healthcare services, like abortion services and community clinics, provides a much better level of care than is possible in the hospital setting. And that's been proven over and over and over. And one that's more cost effective. And perhaps that's the reason, Mr. Speaker, that every government, every province outside of New Brunswick funds abortion services in community-based clinics, except us. So that's puzzling, Mr. Speaker, very puzzling. I don't understand why we're still at this stage at all. You know, more like the Morgenthaler Clinic before 554, many of the patients there are not able to travel to access abortion services elsewhere, and they can't afford to pay for the services at the clinic, so the clinic absorbs the costs, and that's what sunk the Morgenthaler Clinic, because they covered the costs, they covered the costs, they covered the costs till they had no money left to cover the costs anymore, and they had to close the doors. And essentially that's what's been happening, as I understand it, at Clinic 554. Not a sustainable model, Mr. Speaker, for a community-based clinic. Because, why? There's no coverage available from Medicare because of the regulations that are still, in all of these years later, still in place. Fredericton, I'm proud to say, has a long-standing reputation for providing innovative community-based health care, whether it's the downtown community health center pioneered by UNB's nursing faculty, New Brunswick's first midwifery clinic on the north side of the river, which is Horizon Clinic now, the Riverstone Recovery Center, Mr. Speaker, which is the newest addition, and Clinic 554 and the Morgentaler Clinic before it. The current prohibition on the community-based delivery of abortion services in New Brunswick is an anomaly in this country, an anomaly. Every other province has found that providing abortion services through community clinics best meets the needs of women and others with a uterus. A community clinic setting provides a quality of care not possible in a hospital setting, provides accessibility that cannot be provided by centralizing abortion services in designated hospitals, and is far more cost-effective than hospital-based services. We know that Regulation 8420 has been found in contravention of the Canadian Health Act, primarily around the criteria of accessibility. The federal health minister, as has been said, initiated a process to enforce the Canadian Health Act by withholding some of the portion of the Canada Health Transfer to New Brunswick. As we saw just recently, this situation has been condemned by the OBGYN department at Fredericton's own Chalmers Hospital, by the Canadian Society of Obstetricians and Gynecologists, by the New Brunswick Medical Society, and the board of the Horizon Health Network. The position taken by this government, and for many years the Liberal government before it, is incomprehensible. It defies logic. It defies the law of the land in this country, Mr. Speaker. When the Supreme Court, way back in 1988, found the country's restrictive abortion laws to be unconstitutional, the judges in the majority agreed that the procedural requirements to obtain an abortion as set forth in the law were especially troublesome. Only accredited or approved hospitals could perform abortions prior to 1988, which imposed a barrier to local access, they said, in 1988. This is in the Supreme Court decision. And they swept that away, Mr. Speaker, in 1988. Not here. The law at the time also specified that women waiting an abortion were required to obtain approval from a therapeutic abortion committee in a hospital. This was swept away also, although in New Brunswick, in effect, it was maintained as a result of the two doctors requirement that was also put in place by Frank McKenna. But to his credit, Brian Gallant swept that away. A quarter century a little late, but he swept it away. The prohibition on funding abortion services in community clinics in New Brunswick, Mr. Speaker, is a holdover from the age that predates the Supreme Court decision of 1988. It's time to let it go. Way past time. We must ask what is in the best interest of those seeking abortion services. How can they best be served? And it is not forcing them to travel for hours to get to a hospital in Moncton or Bathurst. Every other province has found the delivery of abortion services in community clinics is the most desirable approach. So, Mr. Speaker, gutting the original motion achieves nothing. It doesn't solve this problem. It doesn't speak to the fundamental point of the resolution, which is to finally, once and for all, complete in a way what Brian Gallant began and couldn't finish for whatever reason. Maybe someday he'll write a book and tell us. And that is to remove the prohibition on Medicare covering abortion services in community clinics. Regarding the other medical services provided at Clinic 554 itself, it has been in the vanguard of providing affirming care to the LGBTQ community and transgender care that reflects the complex needs of these patients. People, in fact, are traveling from well outside of Fredericton, were traveling from well outside of Fredericton to take advantage of these services, Mr. Speaker, and has become somewhat renowned in the country for the services it was providing. It also, Mr. Speaker, of course, was providing services to the general population through the family practice that was operating there. And in losing that is another blow to Fredericton, where so many people are waiting for a primary health care provider and have been waiting for, in the thousands, for sometimes years and years to access a family health care provider, and losing those services is only making that problem worse. And of course, as the member for Fredericton North pointed out, it really isn't just about Clinic 554, but it's the need for these health services, as I have repeatedly proposed to Horizon, these healthcare services that are affirming healthcare services for the LGBTQ community in every region of the province, and that Clinic 554 really could be seen as a model to be replicated in community clinics across this province of ours. So, Mr. Speaker, I support the motion brought by the member for Caraquet and seconded by the member for Estigo-Chaleur. I thank them for the initiative. I'm glad that they finally come over to the Green position on access to abortion services, despite their long history of being on the other side of the fence and maintaining their rock-solid consensus with the Progressive Conservative Party until very recently. But they evolved, Mr. Speaker, and that's an important thing. Mr. Speaker, the other side of this House needs to progress, because they're progressive, they say. And they need to progress, and I know they can progress. And today, in this House, right now, at this moment, they have an opportunity to demonstrate to all of us and to all New Brunswickers how they can progress, how they can live up to their name, Mr. Speaker, by supporting this motion, by voting for it, by doing the right thing, Mr. Speaker, to just do it. Thank you, Mr. Speaker.